Wash hands, knock knock. Good morning, my name is Xavier. I'll be your CNA for today. Is it okay if I check your name, Ben? Mrs. Smith, nice to meet you. How would you like to be addressed? Mrs. Smith? So I'm going to help you today with your catheter care. Is that okay? Alright, so I'll be back with the supplies. So I'm going to go ahead and close the curtains, wash my hands, step outside, and gather my supplies. Knock knock. Mrs. Smith, I'm back with the supplies. Raise the bed to a comfortable position. Lower the side rail. Put on gloves. Before washing, check the water temperature for safety and comfort. Mrs. Smith, can you please check the water temperature? Okay, so we're going to go ahead and start the procedure. Mrs. Smith, I'm going to place the chux underneath you. Please cross your arms and cross your right leg over left leg. On the count of 3, I'm going to turn you to the side. 1, 2, 3. On the count of 3, I'm going to lay you back down. 1, 2, 3. Mrs. Smith, I'm going to lower the bath blanket. Apply soap to all the corners. While holding the catheter at the meatus without tugging, clean at least 4 inches of the catheter from the meatus, moving in only one direction from the meatus, using a clean area of the washcloth for each stroke. Use another towel to rinse. The next washcloth is to rinse. The last washcloth is to dry. Mrs. Smith, I'm going to turn you to the side. On the count of 3, 1, 2, 3. Remove gloves. Sanitize. Raise the side rail. Lower the bed to the lowest position. Empty, rinse, and dry the basin, and place the basin in a designated dirty supply area. Put on another set of gloves to clean up supplies. Disposes of used linen into soiled linen container and disposes of linen protector appropriately. Avoid contact between candidate clothing and used linen. Remove gloves. Mrs. Smith, here's your call light. Here's your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be back. So I'm going to open up the curtains, wash my hands, step outside, record, and report.